Welcome back to Daybreak. If you're watching the clock, it is about 6:40. Thanks for staying with us this morning. One of the leading cancer deaths in the Caribbean is from lung cancer. It's also one that's preventable. And now there's a drive to help people kick one bad habit that is a leading cause of lung cancer. Here to tell us more, we have Dr. Albert Glover. He's a smoking cessation expert and professor at the University of Maryland. We have Catherine Dinspel-Powell. She is the Deputy Chief Officer of Corrections and the Rehabilitation Division. And Mr. Billy Adam, who I think everybody knows really well. He is a concerned Caymanian citizen here joining us this morning to discuss further. Good morning. Thanks so much for being here.
Thank you for having me.
We had a statistic earlier in the show. It's nearly 250,000 deaths in the Caribbean region every year from lung cancer. That blows me away. I had no idea. Are you surprised by this?
No, not really.
Okay.
You know, I can't speak to a lot of the deaths, but I'm not surprised by the number. That's probably, since they're much more familiar with, you know, Cayman Islands, you know, they can actually speak to that much easier than I.
Do you think it's a cultural thing still in the Caribbean to have a cigarette, whereas there are other places where maybe it's frowned upon a little bit more?
Well, you know, throughout the Caribbean and throughout the world, of course, you know, the word and that the smoking and cancer goes together is finally spreading, because you have to remember that the tobacco industry for 40, 50 years knew that there was a direct link. Their own institute, the Tobacco Institute, did the studies. Their own institute found out that there was a link. But through the public relations and their advertising, they denied for years and years that there was a direct link. And in a famous Minnesota case in the 90s, that evidence came out. It wasn't another lab or another university study that showed it. It was their own documentation, and that's why initially there was a fine by the United States government of $25 billion that had to be paid to the sufferers of tobacco, the medical institutions, the government, because of all the cost of medical care, because every pack of tobacco in the U.S., it's estimated, in medical care is about $5 for every packet that results at the end of the day, because the care is so expensive and it's so many different illnesses and diseases, and that's why it's tobacco or health.
Right.
You know, if I can ask a question, I'm just kind of curious what the prevalence or just how much people smoke, because that's an unusual number for such, you know, high number for such a small island, because in America it's about 450,000, so it's almost half, or, you know, that's a lot of people in this small island.
Well, it's for the region, for the Caribbean.
For the
yeah, for the Caribbean. No, if it was for the Cayman Islands, that would be...
It would be nobody left.
Nobody would be left,
That's
I agree.
Right.
Yeah, no, it is for the region. Yeah. And there has been legislation that's come into place here in the Cayman Islands. You can't smoke in restaurants or bars unless they are specifically cigar bars. There are some regulations that allow for that. So I think that there is a shift going on here in the Cayman Islands. And it seems like, Dr. Glover, people actually know now that, yeah, smoking causes health problems. But why is it so hard for people to quit?
Yeah, it all comes down to nicotine. You know, if it weren't for nicotine, people wouldn't smoke cigarettes. Nicotine is the addictive agent in the cigarettes, and that's what creates the problem. And, you know, once they get addicted, then it's very, very difficult to quit, because, you know, in America, anyway, they'll make anywhere from 6 to 10 serious attempts at quitting smoking, but only 1 in 3 is actually successful by the age of 65. So quitting smoking is much more difficult than people think. Moreover, what's been happening, at least in America, a lot of the easy quits, that low-hanging fruit that have recognized that it is bad for you, have in fact quit. People are quitting in America in great numbers, but what you're being left with now is a more recalcitrant, more addicted smoker, because they can't quit. And so a lot of the programs that are developing are specifically aimed at the highly addicted smoker, and that's why they came up with the gum and the patch and the nasal spray, and right down the line to Zyban and Chantix, because we're trying to find more and more and different drugs to try to help them in some way with the addiction portion of the nicotine dependency.
So what is your program that you're bringing here to the Cayman Islands then?
It's in particular, there's a 5-day program here, and it's through the Cancer Society and the prison system, the government. It's quite a few people involved that I couldn't even begin to name them all, but they're bringing me in for a variety of reasons to do some radio, television, to speak to the schools today. We're doing it at a couple of schools, and then Wednesday on Thursday, we're actually doing a 1-day workshop, and then on Thursday repeating it, another 1-day workshop on training people how to conduct quit smoking clinics.
Okay.
You know, how they can help
So
others.
it's train the trainers.
Yeah, it's exactly. It's exactly what it is. Train the trainers on Wednesday and Thursday, and that's going to be held at the prison. If you know, it's going to be interesting. And then on Friday, it's working with the health professionals and the medical personnel on the island.
And
The prison is the last of the government organizations to go tobacco smoke-free.
Okay.
And so that's where it's going to be held.
So why, Catherine, was it important for you then, being with corrections and rehabilitation, to get involved?
Well, I think, you know, there's been a lot of discussion in the media, certainly from us in the last year and a half, about the fact that we're really trying to focus on rehabilitation and wellness as part of the re-entry formula for people coming back into society, particularly from the prison system. We obviously have a legal obligation to ensure that the facilities within the prison themselves are smoke-free, and obviously want to be compliant with the legislation. And above and beyond that, we want people to be more healthy than they were when they came into the prison. And we did, the National Drug Council helped us to do some initial surveys just to sort of test the water and see what the level of interest was amongst inmates and staff, because we do have a number of staff who also smoke. And the level of interest is quite high. For those people who are some of those long-term recalcitrant smokers that Dr. Glover's talked about, there are some of them who've said, yeah, I've tried on my own 6, 7, 8 times and I'd like to stop. There are others who are sort of sitting on the fence and not too sure but want to know something about it. And then there are also the non-smokers in prison who are concerned about the fact that they're being exposed to secondhand smoke.
Of course, yeah.
Inmates and staff again. So I think at the ministry, and certainly with the prison management and with the support of people like the Cancer Society and Mr. Billy and the community and public health, we really felt that it was important to move this initiative forward and ultimately to have a smoke-free prison. And we know that there are obviously steps that we have to put in place, because there are people who've really depended on nicotine to help them cope. And we know that it is an addiction, so we didn't want to just set a deadline and say that as of this date there's going to be no more smoking in prison. We obviously want to provide them with some of the supports, whether it's things like the patch, etc., which are now available to inmates who want them, but then also with the support of an actual program that's going to help them deal with some of the other issues. So we're really hopeful and looking forward to the fact that we're going to have a great deal of success with this program.
And some of the prisoners are actually, the inmates are actually going to be trained to be smoking cessation counselors
as well
to assist, and some of the staff. And there's going to be a whole session just for the Her Majesty's Prison System on Friday.
Okay. I want to mention, we don't have a member from the Cayman Islands Cancer Society here, but this is a joint project. As you mentioned, it's the Health Services Authority. You've got rehabilitation. You've got obviously the Cayman Islands Cancer Society, Education Department, all involved. So this is a great program for people who want to find out more information. They can go to CICS, that's Cayman Islands Cancer Society, CICS.ky, or call 949-7618. Thank you so much for joining us this morning.